This is Case Conversations, video number 3 of a special edition case in partnership with the McKenzie Institute USA. The patient, a 44-year-old male. Chief complaint, anterior and medial knee pain. The assessing clinician, Mr. Scott Herbowy of Austin, Texas, USA. Our panel of experts managing the question and answer session, Dave Oliver, Cora A. Tona, Gary Dykes, and Scott Herbowy. I'm Jason Ward, and I'll be moderating this patient case 3-part series. Welcome to Case Conversations for this special edition case in collaboration with the McKenzie Institute USA. Again, this is a 3-part patient case, including the initial examination and 2 follow-up sessions. Today's footage is the third of 3 videos. The third video will be followed by a live and recorded question and answer session with our panel of experts, Dave Oliver, Cora A. Tona, Gary Dykes, and Scott Herbowy. We invite you to obtain a McKenzie reassessment form and complete it as this reassessment is conducted. Like before, we would also encourage you to make note of any questions which you'd like to email to our panelists following Part 3 for them to answer. Please send your questions to the email address caseconversationsmdt@gmail.com. So without any further delay, here's Part 3 of this special edition case. Enjoy.
Okay, Brian, we thank you for coming back again today. It's been about, I think, 5 days since we last saw you. And last time we moved your knee around quite a bit, and we recommended that you do the exercise up against the wall where you twist on the muscle to the inside and straighten it. And have you been able to do the exercise?
Yes.
Okay. And you've been pretty regular with it, 6 times a day?
Mm-hmm.
Okay, very good. And so we need to ask you, Brian, as a result of doing that, has anything changed in your knee? Do you think overall your knee is better? Is your knee worse, or is it the same?
No, I'd say it's much better.
It's much better.
Mm-hmm.
Okay. And what makes you say that? What would you know? What have you noticed that's different about it?
Well, whenever you have me do the exercise, I'd say about the first couple of days, it was really sore, like it did, like the one you had me do before when I said it was achy.
Yeah, you had the ache again.
This one lasted for about 2 days and it was really achy.
Okay.
But then after that, after the third day, about the third day, it went away and I haven't had it since.
You don't have the ache anymore.
Yeah.
And how about the inside pain?
No.
You haven't had that?
Mm-mm.
Okay.
Yeah.
And with respect to activity, I think you had mentioned stairs and getting out of the car.
Well, since after that third day, since I didn't have the ache and I did it again, I decided to do a little bit of a jog just to check it out.
Sure.
No problem with that.
You were able to jog,
Mm-hmm.
okay.
I was able to jog, yeah. So I was a little apprehensive at first, but I said, well, this feels a little bit different than it did last time, so let me try. And so I was glad I did. Stairs, no problem.
No, okay, and stairs haven't been a problem. Okay, so and getting in and out of the car, have you noticed that?
No.
Okay, so seems that getting in and out of the car better, stairs better, and you were actually even able to jog.
Yes.
Okay, good. In any way are you worse?
No, not at all.
Okay, very good. So we're going to go ahead and take a look at the knee again today and see what we're going to do from there. So first thing, let's have you go ahead and lie in the back.
Okay.
Okay. Any pain right now, Brian?
No.
Okay. So let's go ahead and I'll check the straightening here on it. And I'm going to really push on this thing now. Anything going on there?
No.
Okay. Then let's have you go ahead and you're going to bend it up now.
No problem.
No problem. And how about when I push a bit?
Yeah.
Nothing.
Maybe just a little bit, but nothing. Yeah.
Okay.
Yeah.
Okay.
Nothing.
Nothing really there. Okay, good. And let's have you stand up and we're going to check that squat again, Brian. You know the drill there.
Okay. All right.
All right. Good. And feet apart and down you go.
That was my left knee.
That was your other knee popping. Okay.
Yeah, maybe just a little, but nothing. I can handle that.
You can handle that. Okay, so
that's nothing.
that squat's a bunch better.
Yeah, yeah.
Is that as good as it's been?
Yes.
Okay, that's good.
I feel like I'm back to where I was 3 to 4 months ago before this actually happened.
Okay.
I feel like
all right, good. And can you come on over and show us the exercise? Why don't we put you against here? It's not quite on the corner. It's a little harder. It'll be a little easier to balance there.
Okay. So I turned my foot out like that.
Okay.
And I did this. Well, I had it bent, and I really tried to rotate like he said, and then pushing back.
Good.
Yeah.
That's
and I
it.
rotate and push
And have you done some of these yet today?
back.
Okay, okay. So let's go ahead and have you do a set of them then, Brian.
Okay.
Okay. The knee feels better if you forget to do it. All right. And have you push down real hard.
Okay.
Good. And have you give it about 6 or 7 more. Having any pain with this, Brian?
No.
Okay, good. And really twist and push. Good. It's twist and straighten. Very nice. Good. And I ask you to give it one more.
Okay.
Good. All right, very good. Could I have you come on back over
Okay.
and ask you to check the squat again? All the way down, and what's happening there?
Yeah, like I said, it's
That's good.
Yeah, that's good.
Okay, so we have a seat here. Well, obviously, Brian, it looks like we've got the right exercise now. Okay, you just have to keep up with it, and I know that's difficult when it feels better. You kind of forget about it. And we'll check in a week. Over the next week, we'd ask that you continue with that about 5 times a day. Most likely, you're going to be doing this exercise for a number of weeks to get this thing to fully go away. And I know it feels much better, but our experience is that if you taper too quickly on the exercise, the pain will probably start to return. You'll know if you're not doing it enough because your knee will start to bother you again. Now, do you plan to go back to doing some more jogging?
Oh, yes.
Yeah, and we would encourage you to do that. We would ask that you make sure to do some of the exercise right before you jog.
Okay.
And if you jog and you start having some pain and the pain starts to get worse, if you're able, interrupt your jog, and if you can find a tree or a wall, go ahead and do some of the exercise at that moment and see if the exercise doesn't control the pain at the time you're having it.
Okay.
And if you're able to jog and you're fine, and then afterwards your knee is bothering you, again, try some of the exercise. We want you to think of the exercise as a pain pill.
Okay.
And I know a lot of people think that if their knee is hurting, they shouldn't do the exercise. They're worried about overdoing it. But we really, if it's the right exercise, the time to do it is when you have the pain, to see if it doesn't take care of the pain. And I think that'll happen for you based on what we're seeing here. Okay?
And I guess that's probably, the other day when I did jog, I did have a little soreness after, and I didn't do this. Probably what I should have done.
Well, how long did the soreness last, Brian?
It didn't last that long.
Okay.
Yeah.
You know, if you're talking about soreness that went away in 5 or 10 minutes, you know, maybe 20 minutes, that's okay. I'm really talking about if you come back and you feel like my knee's hurting.
Okay.
You know, a little bit of sore, we all get a little bit of sore. There, you know, the tissue still takes time to heal in there, so to feel some soreness, but as long as the pain doesn't linger for more than about 10 to 20 minutes, then we're not worried that that it's going to be a big problem for you.
Okay.
Okay? Do you have any other questions, Brian?
I think that's it.
Okay, we'll see you in about a week.
Okay.
All right, thank you very much.
Thank you.
All right.
And there you have part 3 of this special edition patient case. We hope this follow-up assessment has been helpful for you and has stimulated some questions related to Scott's assessment, education, and treatment to the extent that you have questions. We encourage you to send your questions and comments to our panel of experts, Dave Oliver, Cora Aitona, Gary Dykes, and Scott Herbowy, to the email address caseconversationsmdt@gmail.com. We will be reviewing your questions and preparing answers to those questions for that question and answer session with our panelists, which is scheduled for this coming Tuesday, June 2nd, 2020. Be sure to mark your calendars for those of you who would like to join us live, but if you're unable, you will receive a link for the recording following. On behalf of the Mechanical Care Forum and the McKenzie Institute USA, thank you for participating in this special edition case, and we look forward to being with you for this third question and answer session shortly.